Europe is quietly baking to death, and most of us still treat it like a weather forecast instead of a full-blown health emergency. That blunt warning, delivered in an open letter to the World Health Organization on Wednesday, comes from the Pan-European Commission on Climate and Health, PCHC, an independent panel of scientists, doctors, and policy specialists convened by WHO Regional Director Dr. Hans Kluge. The commission, launched in June 2025, is racing to finish a set of concrete recommendations for the World Health Assembly in May 2026. But here's where it gets controversial. Some members argue that even that timeline is too slow because the crisis is already here. The letter pulls no punches. This is not tomorrow's problem or an occasional summer inconvenience. It is a public health emergency unfolding in real time. Why the urgency? Because heat waves across Europe are breaking records for frequency, intensity, and lethality. When the mercury climbs, the human body's built-in cooling system, sweating, can be overwhelmed. The result is a cascade of medical trouble: heat stress, heat exhaustion, heat stroke, and the worsening of chronic illnesses such as heart disease, kidney failure, or diabetes. In the worst cases, death arrives days or even weeks later, which is why heat is often called the silent killer. And this is the part most people miss. Heat already outranks every other weather-related hazard in Europe when it comes to sheer loss of life. Over the past 20 years, heat-related deaths have jumped by 30%. The combined toll for 2022 and 2023 alone surpassed 100,000 fatalities across 35 European countries, according to the Commission's analysis. Projections suggest the curve is still pointing sharply upward. Who is most at risk? Picture your elderly neighbor who lives alone, the construction crew pouring asphalt at noon, a pregnant woman commuting on an overcrowded bus, or a child in a top-floor apartment with no air conditioning. Add to that list anyone with a disability or a pre-existing medical condition, and anyone whose home was built long before insulation standards existed. In short, vulnerability is unevenly and unfairly distributed. But the danger doesn't stop at heat stroke. Warmer temperatures are rolling out the red carpet for diseases once confined to the tropics. Mosquitoes that carry dengue, West Nile virus, and chikungunya are now breeding happily in European suburbs. The European Centre for Disease Prevention and Control, ECDC, logged 1,436 locally acquired West Nile virus cases and 304 dengue infections in 2023, more than double the total from the previous 2 years combined. If that trend continues, a simple evening stroll could carry a risk our grandparents never imagined. Healthcare systems are already gasping under the strain. Portugal saw daily hospital admissions spike by 19% on heatwave days between 2000 and 2018. In France, emergency department visits doubled and physician consultations tripled during the 2022 heat waves. Ambulances queued outside hospitals, IV fluids ran low, and exhausted staffs worked overtime in wards that felt like saunas. The letter warns that these snapshots are not isolated incidents. They are previews of a future that will become routine unless action accelerates. So what does accelerated action look like? The Commission's prescription is twofold: emergency preparedness and long-term prevention. First, every country needs a heat health action plan. Think of it as a fire drill for extreme temperatures. These plans trigger early warnings, open cooling centers, dispatch outreach teams to check on vulnerable residents, and free up hospital beds by postponing non-urgent surgeries. Portugal and France have pilot versions, but coverage across Europe is patchy at best. Adopting these plans must be a priority, not in a few years, but now, the coalition insists. Second, governments must rewrite the very definition of progress. Instead of tracking GDP alone, the Commission urges new metrics that place health, well-being, equity, and sustainability at center stage. Cutting greenhouse gas emissions, expanding urban green space, retrofitting buildings for better insulation, and planting street trees are not just climate policies, they are health interventions. One eye-opening statistic: boosting urban greenery by 30% could slash heat-related deaths by up to 40%. Imagine turning your city's concrete jungle into a literal lifesaver. A letter closes with a line that sounds almost like a mantra. The climate crisis is a health crisis, and climate action is therefore health action. Controversial twist. Some economists counter that aggressive green spending could divert resources from hospitals and medical research. Others argue that every euro spent on prevention saves 3 in emergency care. Who's right? That debate is still simmering. Now it's your turn. Do you think declaring heat waves a public health emergency is an overdue wake-up call or an overreaction that could fuel panic? Should governments tax carbon to fund cooling centers and tree planting? Or is that an unfair burden on low-income families? Drop your thoughts below. Agree, disagree, or bring a completely different angle. The comment section is open, and the conversation is just getting started.